Have you ever selected your healthcare provider or facility based on whether or not they were in or out of network with your insurance carrier? Today, I'm going to discuss some of the misconceptions, misunderstandings, and potentially missed opportunities for you, as well as discuss some of the common questions and statements that we receive. Hey everybody, this is Michael with Total Physical Therapy, and today I'm going to hopefully educate you on the idea of in versus out of network status with your health insurance plans. Now, in a prior video where I discussed some of the nomenclature of health insurance, I discussed the fact that when we're talking about in versus out of network coverage, you want to leave that aspect of your decision making to the very end. We strongly discourage people from making a decision on who they use, where they receive their care off of this idea alone, because you'll oftentimes be misrepresented by what you're actually seeking. To understand this better, let's talk about the pros and cons of each. Starting first with an in-network provider. Now, some of the pros of choosing an in-network facility includes a typically lower upfront cost. These lower upfront costs are a result of typically lower deductibles, lower out-of-pocket maxes, and reduced coinsurance and copayment stipulations on your policy. Other pros include the ability to search for providers online through your insurance carrier's website, as well as by phone. And in searching for those providers, they oftentimes have some type of reviews that are available, but we argue that reviews are easily accessible these days online through the likes of Google and other social media outlets as well. Other pros to in-network status includes the likelihood to see the majority of your medically necessary care actually be covered by the plan. This means that most of the interventions that you receive in your visits with your providers are typically going to be covered at the set stipulations by your policy. Now, let's get into some of the cons of choosing a in-network provider or facility. Some of the cons include the potential that you might find better qualified providers and facilities in an out-of-network status. Now, these providers and facilities might just have better credentials, better specialization or experience with your subject matter, and they might be, quote-unquote, the facility to go to for you fill in the blank. A big con that you might find in seeking care from an in-network provider is you possibly might be subjected to what's called a mill facility. Now, a mill facility is a generalized term that usually means that a high volume of patients are flowing through that practice, and typically that high volume is coming through the door to offset some of the cost responsibilities that practice is seeing as being an in-network provider. Now, this at times can lead to fatigued, overworked employees and just generally disengaged staff. This could ultimately negatively impact your experience with that facility, and more specifically negatively impact the care that you receive and the results that you're seeking. Another con to in-network status is that you could be subjected to more care than what's medically necessary. This means that those initial upfront cost savings based off of the lower stipulations on your plan, like the deductibles and coinsurance, etc., this might mean that those lower upfront costs actually result in a higher out-of-pocket expenditure in the long run. You might be subjected to more procedures and more visits than what you truly need. So let's shift our focus over to an out-of-network status, first talking about the pros. Now, typically, those staff and facilities are more engaged than the patients. They're typically more engaged because they have a lower volume, which means that some of those disgruntled staff members are not working in these types of facilities because they're not overworked, they're not overburdened. They typically give higher levels of personal attention and greater access to the staff between your visits. Other pros of seeking care in an out-of-network facility includes the idea that often fewer sessions are actually needed in a plan of care. So in physical therapy, for example, if you've had a referral to therapy and you've been asked to go for 3 times a week for 6 weeks, you might find yourself in an out-of-network facility where they tell you that you may only need 4 to 5 visits. This isn't unheard of from out-of-network facilities, and while some people might feel like that's inadequate care, oftentimes what you're being prescribed is overprescription and overutilization of your medical staff. Another pro of seeking care in an out-of-network facility oftentimes is a better experience through follow-ups and communication between your visits. We see that a lot of times we're able to lend a helping hand through simple telephone conversations or video chats or emails. Oftentimes you won't find this in busy, overworked facilities. Now let's get to some of the cons of out-of-network status. Now typically they are higher upfront costs. Insurance plans typically want to distract you from seeking out-of-network coverage, and they'll do that through higher deductibles, higher copays, higher coinsurance, etc. But there are many plans out there that do not have this, so it behooves you to actually look into the finer intricacies of both in-network and out-of-network stipulations on your policy to see if you might have some equivalent coverage. Other cons of out-of-network facilities include the fact that out-of-network facilities might not bill on your behalf. This means that you might have to become familiar with how to do your own medical billing. Now that we've covered some of the pros and cons of both in-network and out-of-network status, let's draw our attention to some of the common questions and statements that we receive. So a question we've got in the past is, my insurance wants me to go in-network. All of their lingo through phone calls and literature on their website suggests that I need to seek care in an in-network facility. What gives? Well, let's just look at the reality of why your insurance plan does this. Your insurance is trying to control their cost and expenses with your plan by dictating and controlling where they want to send you, which is to in-network providers because they have a contractual relationship with that provider. Another statement that we've received is a facility chooses to be out of network because they're greedy. Well, contrarily to this idea, that's often not the case because oftentimes those facilities that are out of network are choosing a business model to value your care rather than what the insurance policy wants to dictate. Remember, when you are utilizing health insurance, you have a provider, you have an insurance plan, and you over here. But unfortunately, you can't always have the direct say and direct communication with that provider because your insurance carrier is in the middle dictating the terms. Another statement that we've received is, why aren't you in network with my carrier? Doesn't it pay you better? Well, some carriers in certain regions are highly respectful of providers and they take ownership and they seek an opportunity to let all parties be satisfied. And when we talk about all parties, those parties include you, the insurance plan, and the providers. So in a perfect scenario, you have all three people happy, all three people getting what they are seeking, and it is utopian. So there are some insurance carriers that are highly respectful of the providers, and you will find certain facilities that are in network with those that have that type of relationship with their providers. But on the other hand, there are some carriers that do not want to take on that responsibility, and therefore they oftentimes will create distrust and tension between providers and the carrier, leading to the inability to create that in-network status between the two. Another common statement that we get is, your facility refuses to join my network. Well, unfortunately, this is not always a reality. Sometimes it is a choice, but oftentimes we will find insurance carriers that will not allow providers in network, despite an aggressive stance by the provider to try to obtain a contract with the insurance carrier. So I hope that this information gave you some insight as to determining the difference between in and out of network. By all means, there is not a wrong and a right in this situation. You should not, as we encourage, you should not use the idea and the concept of the network status to dictate on the care that you want to receive. Rather, that idea should be at the very end. It should be the very last consideration, after you consider what your needs are, what that facility provides and how they provide it. Then you can start to look at the details of whether they're in or out of network, and hopefully you can use this video to reflect on and determine whether those pros and cons of either status suit your needs the best. So now let's talk about total physical therapy. Could it be true that you could take the pros of both in as well as out of network status, combine them, and create a business model around those positive aspects of both? Well, over our 20 plus years of business, that's what we've sought to achieve. We take some of those pros of both those network statuses and try to combine that into a facility that offers excellent individualized care, paying attention to those details, helping you understand what your costs are before your treatments, helping you by offering our billing services on your behalf, regardless of the network status, and most importantly, delivering the results in the least amount of time that it is necessary to create positive changes to your lifestyle.